The following procedures create a tamponade in hypovolemic pelvic injury except A. Angiographic embolization, B. C-clamp, C. External fixation, D. Pelvic sheath, E. Pelvic binder. And the answer is A. Angiographic embolization. Now let's get to know a bit about each procedure. In patients who are both hemodynamically and mechanically unstable, and in whom the major bleeding is thought to be related to the pelvic fractures, external stabilization of the pelvis becomes the first priority. Because of the main sources of bleeding are most frequently the presacral venous plexus, around 80%, and fractured bony surfaces, external stabilization decreases the hemorrhage by reducing the volume of the pelvic basin and approximating the fracture ends. Example of an external stabilization include 1. Pneumatic anti-shock garments, PASG, or medical anti-shock trousers, MAST. 2. Pelvic binders or pelvic sheaths. 3. Anterior external fixator, AEF. 4. C-clamp. Regarding angiographic embolization, it is used to control a post-traumatic intra- and retroperitoneal bleeding. Vermanos et al. Reported on 100 patients evaluated by angiography for bleeding from major pelvic fracture or solid visceral organ injuries. In total, 80% patients were embolized due to active contrast extravasation or indirect signs of vascular injury or hemodynamic instability. Angiographic embolization was safe and effective in 95% of these patients. In a study by Agolini et al. Of 806 patients admitted with pelvic fracture, 35 underwent pelvic angiography and 15 patients, only 1.9%, required embolization. Bleeding was successfully stopped in all of the embolized patients. However, there are still no studies that report the true frequency of arterial bleeding in unstable pelvic fracture. Angiographic embolization is time-consuming, and using this technique hinders the simultaneous treatment of other injuries. The answer to our question, angiographic embolization is rarely indicated in patients with unstable pelvic ring fracture and hemodynamic instability. Angiography can be justified only in patients who are hemodynamically stable with arterial bleeding detected by computed tomography or with ongoing hemorrhage after C-clamp or application and pelvic packing. Okay, thank you.